Assalamu alaikum. I am Dr. Asma Hosna, Associate Professor, Department of Pathology, Bashundhara Ad-din Medical College. Dear student, welcome to your today's pathology session. Today I am going to discuss about a new topic, that is pernicious anemia. So you know that pernicious anemia is also a macrocytic anemia, and which mainly occurs due to deficiency of vitamin B12. So pernicious anemia is a chronic disorder, and the age incidence is middle and old age, and the basic pathological lesion is gastric atrophy, and those of vitamin B12 deficiency. So patient may present with macrocytic anemia, glossitis, and nervous system involvement. What are the pathogenesis of pernicious anemia? It is occurred due to failure of synthesis of intrinsic factor, as due to vitamin B12 absorption. The intrinsic factor is a major factor which need for the absorption, and due to gastric atrophy there is a deficiency of intrinsic factor, and so vitamin B12 of food is not absorbed, and also the formation of parietal cell antibody and the intrinsic factor antibody in our body, that is called autoimmunity. These are the pathogenesis of pernicious anemia. At first there is a gastric atrophy. So you know from the gastric parietal cell the intrinsic factor is released, so there is reduced intrinsic factor secretion, and so failure of absorption of dietary vitamin B12, and when there is deficiency of vitamin B12, patient may present with megaloblastic macrocytic anemia, glossitis, and peripheral neuropathy. What are the presenting manifestation of pernicious anemia? First of all, anemia on effort, and also congestive cardiac failure, then paresthesia, glossitis, recurrent diarrhea, anorexia, weight loss, abdominal pain, mental disturbance, and visual disturbance. How will you diagnose a case of pernicious anemia? At first we will observe the clinical features, that means clinical pictures, and then we should observe the peripheral blood film, and we will find macrocytic blood picture, and then we will do bone marrow examination, and we will get megaloblastic bone marrow, and then we will see the vitamin B12 assay, and we get low serum vitamin B12, and also we find positive serum intrinsic factor antibody, and the characteristic radioactive vitamin B12 absorption test also done. Now our next topic, that is pancytopenia. What is pancytopenia? Pancytopenia is a reduction in the blood count of all major cell line, and so we can say that pancytopenia is the simultaneous presence of anemia, leukopenia, and thrombocytopenia. When the hemoglobin level is, in case of male, 13 gram per dl, and in female it is 11.5 gram per dl, and the WBC count is less than 4000 per cubic millimeter, and the platelet count is less than 1.5 lakhs, then it is called pancytopenia. What are the causes of pancytopenia? It may occur due to decreased bone marrow function, and it include aplasia, acute leukemia, myelodysplasia, myeloma, then infiltration with lymphoma, solid tumors, tuberculosis, megaloblastic anemia, paroxysmal nocturnal hemoglobinuria, myelofibrosis, hemophagocytic syndrome, and also the pancytopenia is occurred due to increased peripheral destruction like splenomegaly. Now, what are the investigation of a patient with pancytopenia? At first we will observe the clinical features, and which may attributed to anemia, leukopenia, thrombocytopenia, and those of positive disorder. Then we will do the blood examination, After that, examination of the bone marrow, trephine biopsy, and lastly special investigation for the provisional diagnosis. What findings we will get in case of pancytopenia? The essential investigation in all cases in peripheral blood film. If we get anisocytosis and poikilocytosis, it will find in case of myelofibrosis. And the white and red cell precursor cells, if the white and red cell precursor cells are present, it indicates that leukoerythroblastic blood picture, which are common in case of subleukemic leukemia and metastatic carcinoma. We can also get toxic granules in the neutrophil, which is common in case of aplastic anemia. If we get the hypo and the hyper segmented neutrophil, it may occur in case of myelodysplastic disorder. And if we get marked rouleau formation, it indicates that multiple myeloma, and if we get giant platelet, it indicates myelodysplastic disorder. And after that, we will see the ESR. If ESR is highly raised, that is sky rise, it indicates multiple myeloma. And we can also do the bone marrow aspiration or trephine biopsy, which is usually which is usually diagnostic in case of subleukemic leukemia, multiple myeloma, and aplastic anemia. We can also do some further investigation like bone X-ray in case of multiple myeloma, metastatic carcinoma. We can do chest X-ray in case of lymphoma, carcinoma of the lung, or tuberculosis. Also do serum alkaline and acid phosphatase if we suspect it's a case of metastatic carcinoma. We can also do serum protein electrophoresis in case of multiple myeloma and macroglobulinemia. Then DNA antibody test in case of systemic lupus erythematosus, urinary Beng-Jones protein in multiple myeloma, and lastly we do the needle biopsy of liver. In this way we can diagnose a case of pancytopenia. That's all about student lecture, my dear students. Inshallah, see you again in our next classes. Till then, Allah Hafiz.